Angina pectoris. Angina pectoris. Actually, this is a type of chest pain which caused by reduced blood flow to the heart. Angina is a symptom of coronary artery disease. Chest pain due to coronary artery disease and myocardial ischemia. Uh, here, exertional angina, which pain usually occurs during physical exertion or stress. Vasospastic angina may occur at any time and is due to coronary artery vasospasm. Untreated coronary artery disease and angina pectoris may lead to myocardial infarction and death. Some early symptoms, angina symptoms included chest pain or discomfort, possibly described as a pressure, squeezing, burning, or fullness. Pain in your arms, neck, jaw, shoulder, or back accompanying chest pain. Nausea, fatigue, shortness of breath, sweating, dizziness, etc. What causes angina pectoris? Angina, which is known as angina pectoris, occurs when the flow of blood through the coronary arteries to heart muscles is insufficient to meet the heart's oxygen demand. So it is what? Angina, which is also known as angina pectoris, occurs when the flow of blood through the coronary arteries to the heart muscles is insufficient to meet the heart's oxygen demand, such as during physical activity. Coronary artery disease is most common cause of reduced blood flow to the heart in people with angina. There is three type of angina, including macrovascular angina, pharyngometal angina, stable angina and unstable angina, and variant angina. And here is a picture image of angina. The chest pain is the common symptoms I have told you. The type of temporary chest pain, pressure or discomfort. And what will be the heart condition during this angina pectoris, during this pain? Narrowed the artery. Arteries are getting narrowed. Ischemia is occurred. That means a heart muscle is not receiving enough oxygen due to the narrowed coronary artery. Now, these are the drugs, type of drugs which are used to treat coronary artery disease. Their classifications are like that: nitrates and nitrates and nitrates, beta adrenergic blocking drugs, calcium channel blockers or calcium antagonist, also referred to as calcium channel blockers. I just told you what are the classification of angina. There is a stable angina and unstable angina was there. The first line medicines like beta blocker and calcium channel blocker plus nitrate. Then secondary prevention is angiotensin receptor inhibitors angiotensin converting enzyme blockers, especially in diabetic patients like statin and aspirin. Here's some contraindications are there, like a beta blocker. You don't need to read all those things. Just for I have put it just for your information. Like a beta blocker in contraindications like severe bradycardia, second or this is actually adverse drug reactions or contraindications or the ADRs, like severe bradycardia, second and third degree AV blockage, low output state heart failure, and calcium channel blocker contraindications of pulmonary edema, heart failure, severe hypotension. Drugs which are used to relieve acute attacks of angina. Amyl nitrates is administered by inhalation from a glass ampule. It has a sudden onset and duration of action is 5 to 10 minutes. Nitroglycerin is administered as sublingual tablets which require a few minutes for onset and may last for 30 to 45 minutes. Nitroglycerin also may be administered intravenously is more severe cases. This is the most common drugs which is used in treating angina pectoris like vasodilators, cardiac depressions. Under vasodilators, nitrous and calcium channel blockers are there, and under cardiac depressions, calcium channel blocker and beta blockers is there. So three classes of drugs which is used either alone or in combination are effective in treating patients with angina. These agents lower the oxygen demand of the heart by affecting the blood pressure, venous return, heart rate and contractility. The classifications of anti-anginal drugs like organic nitrates. Under organic nitrates, isosulfide dinitrates, isosulfide mononitrate, and nitroglycerin is there. Under the beta blockers, atenolol, atenolol, metoprolol, propanolol is there. And under calcium channel blockers, I have told you there are two types: dihydropyridines and non-dihydropyridines. Under dihydropyridines, the nifedipine, felodipine, amlodipine is there. And under non-dihydropyridines, also two classifications are there: phenylalkylamine and deltiazem under benzodiazepines. Phenylalkylamine, their examples is verapamil. So all the drugs which are calcium channel under calcium channel blockers like amlodipine, deltiazem, felodipine, nifedipine, verapamil, etc. Drugs used prophylactically to prevent angina pectoris. Nitroglycerin can be administered as an ointment, as extended release tablets or capsules, or by transdermal patch. And isosorbide is a pentoerythritol nitrates are usually administered orally 3 to 4 times per day, depending on the frequency of anginal attacks. Nitrates and nitrites. Drugs stimulate the formation of nitric oxide, a potent vasodilator of blood vessels. Vasodilation of veins and arteries decreases the cardiac work and cardiac oxygen consumption to relieve that pain and myocardial ischemia. Nitrites and nitrates may causes a drop in blood pressure and reflex tachycardia. These drugs can be used to treat acute attacks of angina or prevent anginal attacks. The adverse effects of nitrates and nitrates are vasomotor flashing, dizziness, and headache. These are all common due to vasodilation. When administered for acute angina, the sudden onset of vasodilation may cause the hypotension, fainting, and tachycardia. Patients should be seated when inhaling or taking these drugs sublingually. Now, beta-adrenergic blockers. Sympathetic beta receptor stimulation of the drugs increases the heart rate, force of contraction, and oxygen consumption. Blockage of beta receptors decreases the cardiac work and cardiac oxygen demand. Beta blockers are used to prophylactically to prevent the angina and can be combined with other anginal drugs also.